So perineural invasion, peri comes from the Greek surrounding. When we talk about the periphery, we're talking about the edges of things. Perineural invasion means that there is invasion of tumor cells around the nerves in normal breast tissue. So your tumor is sitting within normal breast tissue. And if we see that there are tumor cells surrounding the nerves in that normal tissue, the pathologist, this can be seen only under the microscope, the pathologist will report the presence of perineural invasion. This is not that common, but if it's in your pathology report, you're also not so unusual. We don't know what to do with this information. So as I mentioned, perineural invasion is not something we can see with the naked eye in the operating room or on imaging studies like a mammogram or an MRI. We have to see it on the tumor when it's looked at by a pathologist, an expert physician who specializes in, among other things, looking at tumors under the tissue and describing those characteristics in great detail. Perineural invasion may be stimulated by the tumor itself. This is an active area of research. The tumor may stimulate growth of nerves instead of the nerve stimulating growth of the tumor. This may be a phenomenon where the normal breast tissue, the stroma, and other parts of the body are stimulated by the tumor to make nerves. What does it mean for you? Well, perineural invasion is more often seen in higher risk tumors that have higher stage, more lymph nodes, or tumors that are triple negative or HER2 positive. We tend to see perineural invasion in tumors that are otherwise more active. We can also see this in some of the unusual tumors like metaplastic breast cancer, which is an unusual type of cancer in which we more often see perineural invasion. Now, what does this mean for you in your treatment? Well, independent of everything else, there really isn't a clear prognostic impact. So with angiolymphatic invasion, and we'll put a link to our video on that here, it looks as though seeing angiolymphatic invasion under the microscope is independently, regardless of all the other features, associated with a higher risk of recurrence. But with perineural invasion, it doesn't appear to have an independent effect. So all other things being equal, perineural invasion, first of all, doesn't change your stage, probably doesn't change your prognosis, and won't change your treatment. Rather, tumor stage, that is the tumor size and the number of lymph nodes, where it is in the body, hormone receptors, HER2 receptor, and grade are much more likely to drive treatment than perineural invasion. I hope this has been helpful. I know it's a lot of information. Don't forget to go to yerbba.com to get your personalized report. Your Yerbba report will show you everything that's known about your tumor based on the reports that you upload or give us access to, and then it will show you all the treatment options you might hear about when you go to different doctor visits, and the pros and cons of each of those options. There's also a place where you can pick questions that you'll take to your medical team. These are commonly asked questions, and it sort of gives you permission, if you will, to take that question to that particular doctor. Thank you as always for watching, and we'll see you next time.